down quite a bit. Okay, and this is the orthotic. It's not a flat plane split. It's actually got teeth and shapes and cusps and fosses, and so we adjust it so that there's a centric stop on every back tooth. The front contacts are fairly free, and we want to make sure that it's stable, and see the red and the blue marks. So we want to make sure that where she bites and chews, and when we use the tens to get the spots, they're exactly the same, so that her bite and the tens are completely coincident. Okay, so, and we use green wax to make sure there's no torque as well, and make sure there's an even contact around. And of course, then we take follow-up x-rays with her old bite and the new bite to see what the changes are in the position of her jaw joints. You can see the new bite's a lot more forward, which is, that's just where it ended up being. And so follow-up of treatment results, basically she was so well after I did that she said, I'm fine, I don't need to come back. So I get in touch with her through email and talk to her. Basically, she says she does not wear it full time because she sees clients as a therapist, and she removes it for parts of the day. She said, if I take the orthotic out for more than an hour, the muscles in my face ache and there's a grating sound in my joint. So she still experiences some nausea. She's still experiencing intermittent headaches and slight aching in the right shoulder. I've advised her to wear it full time and taking it out in the day and learning to eat and talk without taking it out at all. But ever since she has done that, she's much better. Being a very busy business lady, she's basically back to full work, and she went back to marathon running as well. So she has been in an orthotic now for 6 weeks. In fact, this is actually when I wrote this. There's a later one. But anyway, the man that referred her to my care said, it was a pleasure to refer her to you with all the wonderful work you did with her. She rang me and thanked me immediately for the 4-hour session. It takes a long time. And I felt fulfilled. She told me about the amazing experience and how number 6 was perfect. We spoke the day after you did your magic, and she has been in tears all day. I asked her what the tears were for, being a typical man, and she said it's because she was pain-free for the first time in many years. So this is actually why I do what I do. It's a pain in the butt sometimes. It takes a long time, and these patients are really tiring and very draining, and they're very difficult issues, and they take a long time. But when you can do such a big change on someone's life, you've got to. So anyway, her symptoms: pain in jaw joints resolved, pain around the eyes resolved, pain in lower jaw, upper jaw, neck resolved, pain in shoulder. She still aches on the right, but resolves when she wears the orthotic. Everything is resolved as long as she's got the orthotic in. The minute she takes it out, if she's got it out for more than an hour, it comes back. So really, we do know now, we can test it to say, well, your bite and the position of that is actually so responsible for all the rest of it. It's a good way to test it. So if she ever wanted to have braces or stage 2, which is either full mouth rehab or braces, we know now exactly where she needs to be, and we can move the teeth accordingly. So this is another case, the last case now. It's actually a full mouth rehab on someone who has lost their bite. Okay, and we want to rebuild his teeth in the right bite so he doesn't destroy everything all over again. So I'll show you step by step what we do. So this is Mickey. His treatments was clenching and bruxing, tender teeth mainly on the lower right, difficulty chewing, neck pain was constant, sensitivity on teeth, facial asymmetry, deep mentalis crease, bicuspid drop-off. So you can see here, that's his smile. And his main concern wasn't so much the pain. He didn't come in for pain. He came in because he wanted a new smile. And this is his teeth. What do you think about this? What's happened over the years? He's lost a few teeth, obviously at the back. His bite's collapsed. He's bruxed a lot. Too much wear on the front. So loss of vertical dimension and support. Abfractions. Multiple missing teeth, super eruption of back teeth, deep bite, mobile teeth. And the patient complained, his main complaint was that his teeth used to dissolve away, they said. The dentist said that his roots just dissolved. Okay, but why would roots dissolve? What do you think? Anyone? Yep, parafunction. Yep, yep. So this was his mouth, the condition that he came to me in. So there was a lot of work. He had abscesses, we had to do, perio, endo, extractions, all of that. And then on the inside, look at the palatal. See those abfractions on the palatal? So what do you do? Where do you start with someone like that? Obviously at the very beginning, infection control, all of that first. And then proper diagnosis to see what the structures are, his jaw joints, his bone, for reconstruction. And obviously recording his pre-treatment symptoms.
Extremely well, thank you.
That's good. Now show me your bow tie. This is the first time I've ever treated anyone in a bow tie. Okay, now what I want you to do is just tell me where you have neck pain. We've gone through all the signs and symptoms. Okay, so show me exactly where that is.
Just down there.
Okay, and that's there every day, all the time?
Most of the time, and I'm sure that if I were massage here, or should I, if I put it there, in this area, it will sort of, because if I press there really hard, I can feel.
Okay, so down or back down here.
Yes,
Okay, so that's where it's a little bit stiff every day.
yeah.
Okay. Apart from that, I guess, what we've pointed out was just bite down together. Bite down. We have a fairly, just relax your lips. We have a fairly deep mentalis crease. He's got deep creases in his lips because he's got a shorter lower third. His bite's kind of collapsed open there. You can see that he's missing quite a few back teeth, and very worn front teeth. So we've got a fairly collapsed bite. So this is what we're doing today, is actually finding a new bite for Mickey so that we can build the bite up again. Okay? All right. And hopefully we'll get rid of those neck aches for you.
He's the cutest old man, love him. So obviously we take all the records, make sure we get the angle of the jaw, we're using a Fox plane symmetry bite, and all the scans. I won't go through all them with you, but so we tense it for an hour, and we do some jaw exercises again to decompress the jaw joint and get a more optimized trajectory for his jaw. Okay, so you can see the TENS working. You see how it's contracting the muscles, and he's just stretching and
Decompress the jaw joint. Just relax.
so we use then the jaw tracker and the neurotransmitter to take the bite.
Just relax. Relax now. Relax your legs.
And really the muscles take the bite for me. I don't actually get him to do anything but just relax, and it moves it exactly where the jaw wants to sit.
Yep. Let the machine just turn over. Fantastic.
And I just record it.
Go loose. And relax. Good.
Okay, so we take the bite and of course record where we take it, and then we test the bites. And you can see the difference in the EMGs. So this is the best bite I think we chose. You can see his temporalis and his shoulders really bad. And then with the new bite, if we look at the values on the right-hand side, they're a lot lower and a lot more calm than the ones on the left-hand side. So we know that the bite is actually a better place for where he should be rather than where he's resting. So as long as the bite is better than rest or the same as rest is quite good. Okay, we start somewhere. And what we do then is obviously test the bite with him. He doesn't believe me. I said, that's the best bite for you. He goes, oh, I don't know. But
I'm going to try for your balance. Now we're going to try our bionic bite in. Yeah, right. Oh my God.
So, yeah.
This makes you strong, number 3.
Yes,
Just be with me now.
So after we get the right bite, we send his models to lab and we get a wax up of what we want to build the teeth to. So we usually get the top teeth for the best aesthetics, and the bottom teeth just takes the slack for what the bite needs to be to put his jaw in the right place. And you can see, just with that, see how much open the airway is at the back. Okay, just the posture of that jaw is so different. And then, of course, once you get the wax up, then you plan the whole treatment, do your stents for your surgery and all that. So we put the implants in, and that's the next day after surgery. We've done the implants and the upper, and he's got his new teeth in. And they're all in temporaries at this stage. Okay, so what we do then is, because the top is fixed to the head, it doesn't determine the bite too much. We just do it for maximum aesthetics. We finish the top pretty quickly straight after that. Obviously, the implants need a little bit more time to heal, so we left that. But we finished the top and put temporaries on the bottom. So that's the top. And then what we do is the bottom has got the temporaries still. And so we're now matching the bite to his new top teeth. Okay, and this is how we do it. We get him to chew.
So just chew on that, Vicky. Chomp, chomp, chomp wildly on that. Chomp wildly. Chew, 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 chew. All different directions. Good. And now, so those marks on. Now we're going to use the
So watch his jaw. See the tens? When we turn it up, it actually forcefully closes the jaw.
The tense bite, which is your muscular bite, lines up with what's actually physically in the mouth as your teeth bite. Okay, so that it's in sync with your body. That means that your body will accept it well. And have a look. They should all line up. See the red and the blue coincide and they all line up. And there's contact on every single back tooth and light contact on the front only. Which is exactly what we
So they're all the temps. They're just in plastic at the moment. We haven't done anything to his bottom teeth except put the temps on.
That's fine.
So we keep him in those temps. We keep him in those temps for at least 3 months to make sure that, number one, all his symptoms are gone. Number two, he's not breaking anything. He's not bruxing and grinding anymore. And that it's totally stable. It's not changing. Okay? And so, again, month after month, we check it, make sure that his muscles are happy. And then, once it's stable, we record that like there's no, we really take very, very detailed recordings of exactly where it is so we don't lose it, and we do the full lower rehab and we keep relining it by as we go. So then the full lower is done and we put it in. And there's Mickey. So now we review the symptoms after he's done.
We finished?
Yeah, about 6 weeks.
Yeah, 6 weeks now. Now you used to clench and grind your teeth. Do you still do that?
I've no idea. I never used to clench and grind. You've got the wrong person.
Yes, with all the way. Okay. What about the tender teeth on the right? Are they tender still?
No, that's gone.
Good.
Yes, much better. Thank you very much.
Okay. You had difficulty chewing before.
No problem.
No problem now?
No problem.
Neck pain was constant.
It's not as bad by any means, just a little bit of excessive swimming might bring it back.
I see. But if you don't swim?
No, I'm done.
Good.
So that's him and his wife. They're so cute. So I guess going back to your practice, notice, I suppose, now that I don't know what you all think of this, whether you've seen anything like this before, but when you go back, I'd like you to invite you to go back with new eyes, Focus on the details, every centric stop in every restoration, building nice anatomy on your teeth rather than flat occlusals. Looking at excursive interferences, contours of teeth, movement of teeth can have a profound impact on someone's well-being. Diagnosis as well. Whenever you see a worn dentition, ask the patient if they suffer from persistent pain, like headaches, neck pain, facial muscle pain. Recognize abfractions and pattern of wear. Myofunctional issues. When they have a class 3 bite, observe their tongue posture. Is it on the floor or on the roof? Are they tongue-tied? Are they or have they been a mouth breather? Do they have an open bite due to a tongue thrust? Prevention. If regular splints solve the problem, great. But if not, rather than blaming pain on stress, consider the mechanical, physiological factors in diagnosis and find them an answer. And if you want to know more, read scientific articles, I have a whole heap. If you want them, come and see me. And if you want to know anything else, I'm available. I've got my, hang on, I'll go give you my email and contact. Where is it? Feel free to contact me for anything. And thank you very much for listening. That's all.